Breaking the Silence is an initiative that started 6 years ago when a group of friends lost one of their close friends to suicide in Edmonton. And at the time, this group of friends had no idea about what mental health was, what mental illness was, and they just couldn't understand why someone who is the best looking guy, the best athlete, the funniest, who seemed to have everything one could want in life would decide to kill themselves. And so, you know, they were kind of at an inflection point where you know, they could have said, why us? Why did that happen to him? And just kind of feel sorry for themselves, which would have been completely understandable. What they decided to do was to, first of all, better understand what mental health is. And then they took it a step further, and they wanted to raise awareness about resources available in the community in Edmonton. And so they started a run and walk in Edmonton, and they've had 1,000 participants every year up until this year. And this is the first year the Mental Health Foundation's been involved, and we've been really fortunate to formally partner with 5 other mental health organizations across the province, but also include, you know, 20 plus organizations that are doing work in mental health in Alberta, and CMHA Alberta is one of those partners that we're grateful to have on board. And really what we're trying to do is elevate the conversation around mental health in a very, very broad way around what resources are available, but also try to bring in subject matter experts from across the province and the country to talk about specific issues such as anxiety, schizophrenia, and so forth. And so we thought it was really a critical piece to have CMHA Alberta come in and talk about rural mental health, because I think that's an often underserved area, and I think there's a high level of need there. And so I'm going to hand it over to Tim and Jessica, who both work for CMHA Alberta, and to share some of the work that they're doing and the work that they're doing with CMHA Alberta and rural mental health. So without further ado, thanks guys so much for being part of this, and I really look forward to the chat.
Thanks, Mark.
Thanks, Mark. Well, Tim, did you want to do a bit of an introduction, or would you want me to get started? Because I've got...
Why don't we get started, and then I'll just maybe do a bit when I do my piece, just because it's 12:05. So go ahead, Jessica.
Sounds good. All right, well, I'm going to just share my screen and make sure that I have the right piece so we can use the slides to help guide the conversation. Can you see that?
Mm-hmm.
Yeah, perfect. Okay. So good afternoon. I'm really excited to participate in this great event. Thanks, Mark, for the introduction and the context. That's really helpful. And I feel that hopefully this conversation today will be able to add to some of those, some of the resources, as well as some of the knowledge that people have around mental health and well-being in rural areas. I also really appreciate everyone that's able to participate today. So I have a few goals for the call today. So first, I will talk a little bit, or a bit about the Rural Mental Health Project. And for those of you living in rural areas, you're able to participate and to be able to access training and funding to be able to help move things forward around mental health in your community. So what I will do is make sure that I inform you, all of you, about the main features of the project, talk about our approach to building community mental health, and give enough information so that anyone who's interested, or if you know someone who may be interested, has enough information to be able to participate in whatever way people are comfortable with. And we have a few sections throughout to be able to answer and discuss any comments or questions that you may have for either of us throughout. For the second half of the presentation, Tim will talk a little bit more about mental health and the impact of disasters, considering the sort of health and financial crisis that we're living through right now. As we think it's important to highlight how all of our mental health and all of our well-being is being challenged today by current events. So to get started, I always like to make sure that I underscore that the aim of this project is really about broadening all of our understanding about what mentally healthy people and a mentally healthy community, what that means. So this includes, an important aspect is access to treatment services, and it also includes to think about areas that mental health and mental illness are being impacted, and where the areas that we live, work, and play. And we could also say live or learn and pray as well there. So to get us started, I'll talk briefly about CMHA Alberta. So our vision is mentally healthy people in healthy societies, and two of our strategic priorities are to build and strengthen community capacity for better mental health and to catalyze mental health movements across the province. And as you'll see, this project closely aligns with both of our priorities as an organization. So as a CMHA Alberta office, our focus is on more provincial and population efforts, including things like community development, training, advocacy, health promotion. And we work closely with the CMHA regional offices that provide direct services within communities, but we ourselves don't provide direct services. So those are just some of the things we work on. So you may be interested, and I think Mark did a great job of getting us started here, about what catalyzed the Rural Mental Health Project. And we do know that in Alberta, 38% of Albertans are living outside of the urban centers. And over the last 10 to 20 years, there have been rapid population changes where some populations have more than tripled and others have been in decline due to different industry changes. Reports such as the gap map analysis from the School of Public Health or the Government of Alberta's Valuing Mental Health reports really begin to highlight a lot of the realities and challenges surrounding mental health and mental illness in rural areas. And in response to that, the CMHA team started having many conversations with different stakeholders that are also invested in supporting mental health in rural areas. So in total, we ended up speaking to over 100 different stakeholders that include people living in rural communities, regional partners, and as well as provincial partners. And we ended up bringing together a room of 25 stakeholders to help craft recommendations for what we need to do as a province to move forward to build mental health. And those recommendations are on the screen now. So the stakeholder groups recommended that we use more innovative and community-based solutions to mental health, that we use positive mental health and addictions projects and programming, as well as having communities be the ones identifying training and action plans that are needed in their community. On the flip side, there were also some things that they recommended not to do, which includes not parachuting experts into rural communities because there's a history of that's not always well received. And also to avoid trying to take a strategy that has been developed to work in an urban center and to try to apply that in a rural center or area, but instead having a rural approach that's grounded in rural areas. So the overall goal of our project, so that you know what anchors us, is to work with up to 150 rural and remote communities who are interested in working to build better mental health and to support a mentally healthy community. So there's two major elements of the work that we're doing. So the first is around animator training. And so what we're doing is we are working with local community-based organizations to help us identify a community member who is interested in helping to facilitate and catalyze a conversation in their community. These communities are people we call animators, and I'll define that a little later on. So the animator or the community member receives training and funding to be able to support them to get started in their community. Depending on wherever their community's at, it may be getting started or it may be expanding current efforts. And the training provides different models, strategies, mindsets, and tools for animators to be able to use to help move the conversation forward in a way that's relevant to the community context. Together, animators bring diverse participants, whether those be municipal leaders, people from schools or EMS, whether it's mom groups, recreation or sports people, people from the faith community or from workplaces, and together to define, what is a mentally healthy community mean to us, and what are the specific steps we would like to take right now to move further towards that. So that's the first part of the project. The second part, which is equally important, is the development and supporting of a rural mental health network. And so through training, animators get to know one another and learn from each other about what's going on in their communities. And we believe it's important to continue that sharing and that learning, even as animators are done training and in their community and taking steps there. And so the network is a place for animators to continue to collaboratively learn, to celebrate or maybe grieve some of the things that are going on in their community, and to have that support network and access to new information and ideas. We also work with different provincial organizations and regional partners, so that, you know, there's only so many things that CMHA Alberta offers. So it's important that we access and let rural communities know about other projects, maybe funding opportunities, training opportunities, or resources that our partners have developed that rural communities can access, so to better leverage those things within their community. And so the network has sort of 2 or 3 levels to it. So we'll take a moment to just pause and reflect on the fact that rural mental health is a really complex issue. Simple or even complicated problems can be solved with things like a checklist or a best practice. However, when it comes to complex problems like rural mental health, there is no single solution or silver bullet that will address the complexity of all of the mental health and mental illness issues within each community. So the saying goes, for every complex problem, there is a simple solution that's wrong. So when it comes to the solution for complex problems, they need to be created and shaped in a way that considers and builds on the contextual factors of each community, including things like culture, history, and values, and different things that emerge and priorities as they change. So early on in the project's development, we heard that our approach must help animators and communities to build strategies that are relevant for their situations. And so our approach to that complexity is using a principle-driven approach, where all of the principles that we have can be applied differently in different areas, but are still built with that foundation of different types of evidence, including academic, practice-based, and lived experiences and living experiences of people in the community. So these principles that I'll highlight briefly help to guide and inform the development of the project and the implementation, as well as the training. And the aim here is that they can be applied meaningfully and in a relevant way, and help be reflected in all of the behaviors and guide all of our actions collectively. So what those principles are listed here. So first, we believe in a community-based approach, that communities are powerful when they come together to be visionaries, decision makers, and to be ones that can generate solutions and learn together. And this acknowledges that there are things that community or that service providers can do that community members cannot do, such as clinical work. However, it also acknowledges that there's things that community members can do that service providers can't. So it's bringing balance back to that conversation. We also believe in a strength-based approach or principle, which really aims at finding and focusing on the strengths and the assets that are already existing within rural community, whether those be within the members, the programs, or the environments, and to build and strengthen the connections between those assets. And so the goal here is really about focusing on what are the things that we find energizing and motivating, and how can we build on those things to get more momentum and avoid continuing just listing the services that we don't have. It's important to know, however, we also know, given the landscape that we're in, that more funding for services is likely low, and that can be very demoralizing on only focusing on just that element. So the 5-of-5 approach is the model that you see on the right-hand side. Some of you may be familiar with the Corey Keyes model. And ultimately what we mean to say here is that 5-of-5 people have mental health, and that when we're building approaches, we need to consider what are the ways that we're addressing mental illness, whether that be screening, treatment services, pharmaceuticals, and access to all of those things. And what are the ways that we can also build on creating coping strategies, skills and capacities, and resilient people and resilient environments that support people's mental health. And by having it be sort of a 2 continuum model, it opens up the possibility that you may have a serious mental illness and you can be mentally healthy. Or on the flip side, that you may not have a mental illness, but you may not be mentally well. And so what are the strategies we can use to build the mental health of everybody? We also believe in a whole community or whole systems approach, which in other words means looking for approaches that can build multiple outcomes. Sorry, I'll switch slides here. Multiple outcomes with one activity. So often we focus on services, which I believe is the green slice here, but there are also things that we can, oops, sorry, I need to back that up. Also things that we can do to help build mental health throughout the lifespan, whether it's, men, adult men or seniors or youth, as well as strengthening the social connections and health in our environment. And lastly, our principle around having a developmental approach is simply summed up by saying, when you're 18 years old, what is mentally healthy for you to do is very different than your priorities around mental health when you're 65. And the same can be true for all communities, that what is a priority right now may be very different in a few years. And so a developmental approach is not about having a destination or a list that you achieve of checking everything off, but an ongoing journey where things continue to grow and change as we grow and change and learn as people and as communities. So the overall objectives are summarized here. So it's really about supporting communities to build and strengthen that social infrastructure for collective action, and having that collective work being done in a way that's actually building mental health and being facilitated by animators to be one that is supporting our health and the autonomy of our communities. The second is around building more capacity for more engagement and participation from more people in our communities, so that those strategies continue and learn and grow and evolve with the people. And lastly, as I mentioned earlier, to create a broader view that includes mental health and mental illness, and considering all the different areas in our lives that those are influenced and impacted by. So where we are right now with the project is we're just wrapping up year 2. In the first year and a half, we spoke with many stakeholders and we developed a prototype for training. And then we worked with 24 rural communities to help do iterations and change what we're doing. Now in the project where we're at is really being able to scale up to reach more and more communities who are interested in accessing the training, funding, and network. So I've used the word animators quite a few times, and so now I'll kind of give a little bit more meat to what that means. So when we see the word animators, we see the core word animate, which really means about bringing something to life and giving it energy and movement. So if you think of a stickman image on a piece of paper and an animator, maybe with Disney, that can take that one image and turn it into something that is complex with movement, energy, and a story. And animators can really be the ones that can help start or expand that conversation and bring energy and life into it. So they aren't meant to be managers or coordinators or particular experts, but really about engaging with a broader community of both community members and professionals to be able to facilitate a dialogue that helps people make some steps that help move the needle on mental health in that community. So we also are hoping, well, we hope through the training that they are guided by those principles as well. And animators themselves receive training and they are actually given funding to be able to do the training and to facilitate in their community. On the right-hand side, you see the word +1s. And essentially what that means is that every animator can bring a community member with them to attend training for free, so that they have the additional benefit of somebody in their community that's also gone through training. Two boundaries that I wanted to mention for animators is that we do require that the animator physically lives within the rural community, and we've defined rural community as any community outside of the 7 urban centers, and that they are actually animating within their rural community, because the goal here is that they are a part of the community, a member of that, and that there isn't required additional travel or training to go to a different area or region. So our hope is that animators can bring together these community action teams that are led by the community and reflect the people, values, and priorities. The language that people use may be different. Some people like committees, some people don't. Sometimes committees can make people run away. So it's really about finding a language that reflects the community and the group and the work that they want to do. Community action teams can be more formal, meetings with agendas and terms of reference, and maybe office hour meetings, or they can also be informal if that's a more appropriate way of having conversations. So things that take place on the evenings and weekends, and maybe at a local coffee shop or A&W, where people tend to congregate to socialize on Sunday mornings or wherever it may be. The important part here is that we wanted to distinguish that these are not meant to be interagency coalitions, and it's not to say that those aren't that those coalitions don't add value. It's just that the aim is not around management and services, but broader than that. And I did mention earlier on community organizations that we partner with, and we call them backbone organizations that help us identify animators if they're in a region, and they can identify multiple animators as well. They also receive funding on behalf from CMHA on behalf of the animators and distribute those funds to them. And we also hope that, that the backbone organizations can support animators in their endeavors. Maybe it's through an introduction or offering a meeting space. And this kind of depends on the capacity of each organization, where sometimes that can be a lot of support and sometimes that may not be much. But that depends on each community. So what are the benefits of the project? So for the training, as I just wanted to make sure I underscore, that we provide and compensate animators time while they're in training. We provide and compensate them for their travel to and from training, and for 40 hours of facilitation time in their community over 1 year to help get the conversation moving. And the benefit here from the training is to have the skills built in the community to help support community decision-making and local leadership. When it comes to the network side of things, there's quite a few benefits around, animators being able to stay connected with one another and to learn from what other rural communities have been doing, and maybe, borrowing ideas or helping share ideas about things that have worked. It's also a space where certain communities that are close by or similar to one another have started to collaborate in a way that supports regional connections. Maybe it's around services or events or other means. It's also a space that we continue to offer resources, whether that be access to events, additional funding, or webinars. And that we continue to leverage different and new provincial partners as we get to know them, so that rural communities have access to them. So I'm going to switch gears briefly and just talk a little bit about the details, because you may be wondering, what does training include, before I talk about how to get involved. So in total, the animator training is 7 modules, and 10 hours of that is online, and then there are 4 days of in-person training. We are looking to potentially switching some of that to be more online given the COVID situation, so that may be offered as of September. So the layers that we cover, or that we cover in the training content, build in complexity as you move from module 1 to module 7. And the same sort of 4 layers are woven through all modules, kind of like the cake that we have on the right-hand side there. So one of the layers is around understanding, what does mental health and mental illness mean, what are different models, and what does community wellness mean. We also cover a lot of different elements of community development, from asset-based community development to collaborative facilitation, conflict listening, listening for change, and other elements and processes that can support animators in their work. The third layer is where we say network or cohort learning. Is just important to acknowledge that rural communities are already doing a lot to support the well-being of their families and in their community. And so we create a lot of time and space and training for animators to be able to learn and share with one another. And that also helps support that network and that ongoing relationship even after training. And finally, it's important to know that this type of work can be challenging and uncomfortable. And so we also talk and emphasize a lot about the importance of managing our own well-being and mental health, and thinking about different ways that we cope with stress, as we can name our own boundaries. And so we continue to support animators so that they themselves aren't being burnt out, and that they can role model what mental health care looks like in their communities. So in case you're interested, these are all the communities that have already participated in training, having a trained animator. If you don't have enough time to read through all of them, you can go to our website, ruralmentalhealth.ca, and again, that will be on a few slides from now. And we do have a map that has all of those listed as well. So on the right is a map, but on the website, the better part is that you can actually zoom in and search to see if your community is involved. So the red dots on the map are communities that have a animator who's trained already, and the green are the communities that have reached out to us to express interest in getting involved in the project. So I think in total, we've had over 160 online forms, which doesn't include paper or email. On the left-hand side is all of the Indigenous and Métis communities that have participated so far, and that have expressed interest in some way. And we're continuing our commitment to continue to support our relationship and supporting the mental health in Métis and First Nations communities across Alberta. So the next 3 locations for training are in Grand Prairie, Olds, and Vermilion, taking place in the fall. If you are wanting to know all of the training dates from this fall to all of the dates in 2021 that are available, you can also go to our website as we have those listed. Vermilion right now is full, but we do still have spaces for anyone who's in the Grand Prairie area or in the Olds area. So as I mentioned, our website is ruralmentalhealth.ca. And on our website, there is the online expression of interest form, which is just a few quick questions around, what's your name, what community you're in, and what potential community would you like to, or what training would you like to attend. And then we're able to follow up with you with more details to get next steps to confirm an actual animator. And so that's step 2, is that we have an email and we can have phone calls to share additional information about the project. If you're wanting to stay involved with the project but not necessarily be an animator, you can also be a part of the network. So if you go to our website, you can sign up for our quarterly newsletter updates, which has, highlights what communities are doing, different provincial partners are offering, and more. And you yourself can register onto the network and access different areas, as well as share your own resources, events, that you may want to be able to offer to rural communities that are interested. So for any specific questions, I'm happy to pause now for a few minutes to ask a few questions before we switch to Tim. And whether it's comments or questions, I'm happy to answer them now, or if you'd rather do it one-on-one, I've got my email and phone number there available at the bottom of the slide, and I'm happy to deal with any questions or conversations you'd like to have. So I'll pause there. Are there any comments or questions at this time?
Not seeing any questions. I think somebody, they need to reduce their Zoom window. So in order to do that, I think, yeah, you just have to, the top right of the screen should, if you put your mouse over it, it should allow you to reduce the Zoom window, or press escape.
Yeah, I just tested it. Escape usually works too.
Escape as well.
Yeah. And I'm sorry, I'm going to reshare my screen, so you might have to hit escape again. I think that might be one of the features here.
Okay, I think she's got it. There is a question, Jessica, asking if the training includes substance abuse training or substance misuse training.
There isn't any, I guess, Amy, you can also speak to this. I don't know if we have any specialized training for being able to provide direct services, as the work that we're doing is more about inclusivity and having a community-wide conversation. But we do have different partners that we are working with that can provide that type of training if that's what you're looking for. And if you wanted to contact me offline, I can kind of connect you with a few of our partners that would have something along those lines. Is there anything that I maybe missed there? But I think we talk about different models from different lenses, whether that be, you know, a medical model or system model, Indigenous point, like different points of view, and addictions is incorporated in that. But I don't know if there's a lot of very specific information that you can. Were there any other? I don't seem to see the chat on. Oh no, here we go. I'm just going to open up the chat so I can. All right, well, if there are no additional questions, then maybe I can pass it to you, Tim. And we have a second point for questions and comments at the end. So I will.
Jessica, do you have my slides on your desktop?
I believe I do, yeah.
Okay, I'll just get you to run it then.
And Jessica, maybe if you don't mind, if you put your email address in the chat for folks that might reach out afterwards, that might be helpful for folks.
Yeah, for sure.
Okay, so welcome everybody. Good afternoon. My name is Tim Neubauer, and I work with Jessica. I sort of focus in the area of community resilience and wellness. So part of my time is spent working with the rural mental health team. And then the other part of my time is spent on really working with organizations around the area of developing a more psychologically healthy and safe work environment, workspace. So part of that can be looking at how to create a psychological health and safety management system in the workplace. But one of the things that we just recently did in rural communities, at least in part, there's a webinar that I want to look at 2 slides from that webinar with our time left this afternoon. And really it was recognizing that there's been a number of mental health challenges that people have been going through as a result, not only of COVID, but there's a lot of other challenges too that have been happening in our province. And so how do we support individuals and communities as we walk through this journey together? And in some ways it's uncharted territory. But in other ways, there's some common principles and elements that I guess we could say would help individuals and communities on their road to recovery. And so I want to look at 2 slides here. The first one is what we call the phases of disaster. And this might be familiar to some of you on the webinar. It's also similar to, so some of you are familiar with the grief and loss cycle and also patterns of change. And so you'll recognize the shape of the graph is similar. But this is a helpful way for us to normalize and validate not only what we're experiencing as individuals, but also what family members and community members would also be experiencing in the midst of really what's been a global disaster through the pandemic. And so I want to just look at this graph for a few minutes, and then also we'll show a slide after that really looks at just our challenges to our mental health and things that we can do just to support more positive mental health. So on the left-hand side of the graph, excuse me, we have sort of very much going from emotional lows to emotional highs. And I think all of us can appreciate that there's days probably that we fluctuate from some very lows to some very highs, even in the course of one day. And then the graph itself sort of maps out, and I want to preface by saying that this is not something that is a predictable timeline for everybody where we can say this is how long it's going to take to go through a crisis or disaster situation. But generally speaking, this is sort of a pattern that all of us will follow. The graph on the screen looks at it more from the time of impact of a crisis or disaster to where we'd move into past that 1-year anniversary and then into what a lot of people are using the phrase, the term recovery. So you might be familiar with that phrase. So when we look at disasters and we look specifically at the pre-disaster, so the left side of the screen, this is a phase where there is often a lot of fear and uncertainty, characteristics of that phase. And it really depends on the type of disaster and how a community experiences what is happening to them. And so even with the pandemic, we've seen across Alberta that it's affected communities across Alberta in some very different ways. And not everybody has experienced, obviously, it in the same way. So disasters will mostly come with no warning. And so that can cause us to feel very vulnerable and can challenge our lack of security. Because we really can't predict. I mean, we can get some idea, and we're better at predicting storms and certain types of things that happen in the natural environment. But it is still something that is unpredictable. And so we experience that feeling of feeling unsafe. And so that can cause definitely some challenges to our mental health. Sometimes disasters do have warning. And so people can feel guilty maybe if they didn't heed the warnings. And maybe we begin to even have feelings like, I should have done more, or I could have done more, or did I make all the right decisions? When it's something that we don't have a lot of notice that something's happening, again, we can respond in different ways. This is usually pretty short. It can be as short as a few hours, like, for example, a terrorist attack. But it can also be months. So some communities go through hurricane season in the US, and that can last several months. With the pandemic, I think we had some idea that this was happening globally, and we were definitely watching the news and seeing, what was happening over in China. But people didn't really probably appreciate or understand just the impact that this could have, and also how rapidly it could begin to move across the globe. And when we move to the impact phase, this can be there's a lot of intense emotional reaction that can happen in people. When we think of the context of the pandemic, really that was probably for many people the beginning or the middle of March, when things, I remember on a Friday, it sounded like some things were going to change. And then by Monday, most things were closed or were beginning to close, and things were being canceled. So it was kind of this, it was very surreal. I don't know if anybody on the webinar experienced or felt it that way too, that is this really happening, where things are closing and being canceled? And some of those things were obviously things that could be quite meaningful for people. So that doesn't help when those things begin to shift. Again, creates a sense of not feeling safe and secure.
Tim, can I just ask a question?
Sure.
Sorry to interrupt.
Yeah, go ahead.
But just to your point, and I guess it's a comment from my personal reality, but when the schools closed, that for me was the most surreal thing I've ever experienced in my life. And maybe you could just speak a little bit to your experience or your perspective on what that specifically has meant for increased stress load on families and parents, and trying to juggle work and school. Because that's been, for me, like, my kids just went to Saskatoon to see grandma and grandpa this week, and it's like, I love those kids to death, but man, am I happy they're
having
gone.
a break.
Yeah.
Well, I think we're creatures of habit, or we tend to be. And so routine is so important for people. And a big part of routine in most people's lives with kids is the fact that kids go to school. And so for parents, that's part of our routine, but it's also for kids. That's a big part of their life, is that routine of going to school. So after a disaster, one of the things that's important to restart is some of those routines. So kids being allowed to, go back to school really helps to normalize, it brings back that those patterns that kind of make you feel safe. With the pandemic, because again, in a normal, I'll use the term normal disaster, an earthquake, you can identify when it's over, or there's aftershocks, but kind of when it's over. When a storm passes through, when it's over. And so it's quite predictable to kind of see the transition between the phases. With our pandemic, is it over? Is it a second wave? There's so many things that are still unknown that people are trying to predict. And so the fact that school has stayed closed for the most part in most locations, and there's still uncertainty about the future, what it'll look like in September. It's, again, one of those things that these are things that in our life bring a sense of safety and security, but also a sense of routine. And when that gets disruptive, we revert back to our primary need, really, is food, shelter, clothing, and safety. And so when we're not feeling safe for now, that can cause us to, in our mental health and our emotions, in a whole bunch of different ways to feel off balance. And we'll show a slide that kind of shows that, and how we kind of maybe manage that. Let me just go through the last few phases here, and then we'll move to our next slide. So once impact happens, I mean, that can be quite quick. I mean, generally it's the shortest of the phases. We begin to move into what is termed the honeymoon phase. And really this is a stage where there's often a high level of activity with a lower level of productivity. So in a natural disaster, it's obviously helping people to, clean away the debris or destruction that it may have caused, helping people to feel safe, looking for survivors. I mean, those kinds of things. We hear stories of often some very incredible acts of heroism that take place. When we think of the pandemic context, one of the shocks for many of us was having to work from home and thinking it was probably just maybe a week or a couple weeks, and then reality sets in that this is more of a long-term reality. And so probably what was beginning to happen in that heroic phase for many people was organizations scrambling to figure out how they were going to take work and move it to home, and there was technological learnings. I mean, some people had never gone on Zoom, and now there's people that spend considerable time of their work week on Zoom. And so there's all this activity that's going on, a lot of altruistic type activities. So we were seeing things happening in neighborhoods where people were trying to support neighbors, and so that's the phase that, I mean, we've pretty much moved through. We move into what's often called the honeymoon phase, where that's where we're getting support from the government, financial support, and other kinds of support. Again, there's this sense of perhaps this will end sooner than people are telling us, and we can return back to normal. And I think that's a phrase that probably has different meanings for people on the call now, but recognizing that we probably don't want to go back to normal because normal wasn't probably as good as we remember it, but it's impossible. Any type of event like this, to the measure that we've experienced, you cannot go back to the way things were. It's really more about what it's going to look like, and what do we do. And so the problem with not understanding these phases, where you might be as an individual and also in your organization or community, is because we're all moving at different speeds through this. There's people that might still be in the honeymoon phase, and there might be things that have happened, additional things than just obviously the pandemic. There's other things. Fort McMurray experienced flooding. Even in Calgary, we experienced quite a severe storm a week ago. And so there's people in our community that have had another event happen that again is kind of compounded what already was going on. And so we can move into this disillusionment phase where we wonder if we'll ever get out, if life could ever return back to, the way that we liked it before. We might feel that we're not getting enough assistance. The thing to recognize here, I mean, just because this is part of a lengthier presentation, I don't have a lot of time to go into depth here, but this is all normal. And I think that's really what we wanted to do today, was help people to see that this is a normal process that we all go through, and not to be surprised by it, but also to use it to help others to validate that you are going to have other trigger events, and you're going to have some bumps on the road to recovery. And into the, kind of that reconstruction phase, which is in a physical disaster, a lot of times where we're building physical structures back up. We might be building parks back up, places of recreation. What it looks like for us, in the pandemic, some of that's yet to be determined. Psychological recovery, because disasters do have an impact on us psychologically and on our mental health. Sometimes it can take 3 to 5 years. So to plan for just like a year is very short-sighted. To recognize that how do we support individuals and families and communities in the long term is actually more prudent, because if you're familiar with the grief, loss and grief cycle, there's things called grief bursts. When just all of a sudden out of the blue, someone might get triggered and those feelings of grief kind of overwhelm again. The same is true with disasters, that there'll be times where we think we're doing quite well and we're on the road to recovery, and moving forward, and then out of the blue, something will happen where there's a lot of overwhelm that comes back. And that's normal. That's the normal part of moving through this process. The part that might take a little longer, maybe even a lot longer, is that economic recovery. And I think we're understanding the complexity of what that might look like. So Jessica, if you can go to the next slide, and then we'll also have time to take some questions. I want to look at this slide in particular because it looks at our mental health. And so it's very, very normal at any time in life for us to sometimes feel that we're pushed off balance for what would be us, my balance and your balance. And even more so after a crisis or disaster has occurred. And so what we find is, if you look at the left side, there's certain kinds of positive supports. So that might be, our connections with people in our communities. It could be a counselor that we're seeing. It might be, really meaningful activities that recharge our battery. And on the right side of the graphic are some of the negative experiences, and just noting here, I mean, for some people there has been job loss. Fort McMurray and other communities, there's been flooding that they've experienced. And of course, we've all gone through COVID-19 or are going through COVID-19. And so normally, some things that we would call our positive supports and help might help to keep us in balance, no matter what is happening in our lives negatively. But sometimes we might discover in a situation like going through a global pandemic that some of those things sometimes don't begin or don't have the same effects they once did. And so some of those techniques may not work quite as well. And we might have to adapt those, or we may have to try even some new or bring on some other supports to help us to restore some of that balance. And people can often also look at this as just levels of stress too. When we look at negative experiences, they will cause different types of stress in people. And so I wanted to take a minute here just to, and then we'll do that Menti poll. And if you can't make it work, that's fine. And I'll also have to share my screen in a minute here we'll try that in a second to see how it works. But when we look at stress, we all experience normal types of stress when we go through a disaster or a crisis. Often it's amplified stress that happens, or abnormal forms of stress. So there is no normal way. And we say this a lot to people, and you've probably heard this, but there is no normal way to go through an abnormal global pandemic. I mean, this is not something that we have experience in. And so there are going to be people that are pushed quite off balance and finding a lot of challenges to their mental health. There's others that maybe are more adaptive and have some resiliency skills that help them to more easily come back to balance. I think it's important for us to recognize, though, that we need to give ourselves that self-compassion because we're experiencing some things that we've never experienced globally before, and learning some things. And there's been a lot of stress, as Mark, you said, with, a lot of people weren't used to homeschooling or have never homeschooled their kids, and now they're primary teachers, as well as working from home, and as well as all the other things that come, with family life and our personal lives. And so when we look at stress, I mean, we're pretty good at stress relief. And that's the things that we would do in the moment, like grabbing a glass of wine or buying a chocolate bar, or, binge watching Netflix. I mean, these are things that we've learned to do that can kind of ease kind of that level of stress in the moment. We have to be careful that we don't make that more of a long-term strategy, because there can be some negative consequences to using some of those to deal with stress. And so we want to think of stress management as more of a long-term solution, where we can more predictably help us to manage our stress. And so for me, it was going to the gym. Other people, it's mindfulness or journaling or meditation. And what we've learned the hard way is that for a lot of us, those things were taken away. Maybe not permanently, but definitely in the temporary. There was things that we used to manage our stress that we could no longer do or do in the same way. And again, that puts us off balance when we're not able to do that. And to also consider some of those strategies that when we notice patterns in our lives where going to work, and maybe people at work or certain situations at work are now really creating a chronic anxious presence for me every time that I'm in the work environment. And so that might mean for me to create some more longer term strategies where that it's a new skill I'm learning, or maybe it's talking through things with a counselor, to kind of create a more long-term solution. So I'm curious with people on the webinar today, if you want to just I'll see if I can do okay, Jessica, it looks like I'm getting a message saying you're gonna have to stop sharing first. I was wondering if we could both do that as presenters, but obviously we're going to have to do it this way. So this should have come up for everybody. And so I'm curious if you could name one way that you manage stress. So if you are at menti.com, there's a spot for you to type in a code, 140933. And so if you want to just type in a word or two of a way that you manage stress, it's anonymous, and we should, as people do that, start to see this begin to populate live on the screen. We'll kind of just give a minute just to, and this is one of those word clouds that kind of depending on how many people choose the same answers, the words would get bigger. So we'll give a couple of minutes here for people just to respond if they're able to. So we've got walking, journaling, running, meditation. Looks like they're pretty equal on my screen. And running looks a little smaller, and I would probably concur that that would not be a way I would deal with managing stress. Running would cause me. Okay, so it looks like maybe everybody that was able to answer that. I will switch back to your screen, Jessica. And so just before we sort of take a few more questions here, again, I want to reiterate that disaster stress definitely is different than just the normal stresses that we experience. Would also want to note that, I don't know if you've heard this in social media or on the news, there was a way that things were being phrased at one point of even using language like a tsunami of mental illness that might happen because of COVID. And I want to caution using that language because that sometimes is not a helpful way to describe, which really, for the most part, is we're experiencing distress, normal human distress that's amplified. And people are quite resilient, and most of the research really does show that people recover over time quite well after disasters and crisis happen, and it's about 8 to 10% of people that might need more of that clinical professional support. So the idea is not so much, we want to make sure that we're not creating additional stress by the way we're wording information that we're communicating to our networks and people and communities, but also to normalize that a disaster where it's human distress that we're not used to dealing with, and it's amplified. And there might be multiple levels of negative experiences that were part of just our normal experience. And now those have been added to, as well as the positive supports that were working in the past may not work so well. So we might need to look at both sides of the scale to see how we can manage that stress that's being caused by some of these additional things, and create some solutions around how to work through that, as well as looking at our positive supports and saying, do I need to add something? If something's not working, what can I do to maybe change that so that it might work better? But to really come away and say, you know, for most people with the right positive supports and managing negative consequences and working through our stress, people recover very well and walk through that that graph that we showed earlier of those phases of disaster. So, I notice we just have a few minutes left. Just wondering if maybe there are some questions. I will put an email address on the chat. So if you do want some more information about the 90-minute version of just kind of what we looked at today about overcoming the mental health challenges in a global pandemic, that is something that's available to not just rural communities, but people across Alberta. And so you could reach out for that. Any questions though, just in relation to those slides that we just kind of took quite a quick, we went through fairly quickly. So any comments or questions, or Mark? Yep.
I was just going to say thanks first and foremost to both you and Jessica. I thought, you know, they're both very, very timely topics for different reasons, and they're interconnected in many ways as well. And so it's fascinating and really great work that you guys are doing in both areas. So kudos to you. And I would just say we're going to get booted out of here at 1 o'clock, but this is the purpose of what we're trying to do is to have conversations and human connections as best we can in the virtual world. And so please know there are no stupid questions. Only when I ask a question, Tim and Jessica can call that stupid. I'm fine with that. But you know, if you're curious about something and you're afraid to ask, by all means, you can type it in the chat box, and I can paraphrase and ask the question to Tim and or Jessica. And if not, they both were kind enough to leave their contact information, and I'm sure they would be more than happy to receive any questions or comments that you might have after the end of this webinar. So we'll maybe just leave space for 30 seconds for any more questions. But if there are none, again, thank you so much, Tim and Jessica, for your time. Very much appreciated, and keep up the great work. It's very, very interesting presentation, and appreciate you guys taking the time to do that.
Thank you. Well, and thanks so much for the invitation and time to be able to share with others. Hopefully people were able to get a tidbit or two of something that is meaningful to them. And I hope you guys have an amazing rest of your event as well.
Yeah, thank you all. It's always nice to connect across the province with things that are being done. So together, I mean, I know it's a phrase that we used a lot, but I mean, together really it is how we walk through something like this as communities and organizations and Albertans.
Well said. All right, well, I'm not seeing any questions, so thanks again, guys, and enjoy the rest of the day. I'm gonna end transmission now, as they say, and nobody says that, but I just said that. Okay.
Sounds good. Take care. Have a good day.
Take care.